Hello, ladies. Here I am again, bringing you menopause, your management, your way now and for the rest of your life. And one of the ways you may wish to manage your menopause is with an integrative medicine specialist. Do you know what that is? Ha! I have Dr. Monica Roberson here today to tell you she is an integrative medicine physician.
Hello, hi.
Thank you so much for doing this.
Oh, my pleasure. My pleasure.
My viewers probably don't know what an integrative medicine specialist is. So tell us.
Oh, integrative medicine's wonderful. It's the marriage of Eastern medicine and Western medicine, but really, and alternative and complementary, but really using science and evidence to find what truly works.
Okay. So what would you say is the most significant difference between traditional medicine with a typical MD and integrative medicine?
I'd say the biggest difference is the time spent with each patient.
Really?
I think that's really the main difference.
So tell me about that. What's the difference? Now, by the way, Dr. Roberson is an MD, but after being an MD, she then went and did the training for integrative medicine. So you know both.
Yes.
You know both.
Yes.
So
yes.
what's the difference in the time that you spend with patients?
Well, really, the only way to practice integrative medicine is to spend time and know the patient.
Yeah.
And really, what integrative medicine is about is just connecting on a deep level with each person and understanding what's important to that person and where they're coming from and what's right for that person. I would really call it individualized medicine with a focus on the natural.
And do you feel like you really get to know the whole person? I mean, do you feel like you become almost friendly or close with these people to the point where you just really know them and their families and their social situation and how everything affects their lives?
It's always my intention.
Yeah.
Always been. Absolutely.
That's
Many of the
great.
patients are like family at this point, for sure.
Love it. Yeah. Now, what's the training for integrative medicine?
So there's different trainings, but I did the training through the University of Arizona Center for Integrative Medicine, and it's a 2-year program. It's for physicians who are actively in practice, and so it's it's done online and by going out to Arizona. So it's a combination of that.
Yeah.
So the idea is to really work with physicians who are actively in practice.
Okay,
so
and what does it involve? Do you learn just the alternative and complementary aspects and the herbal and botanical and things of that nature?
And nutrition. Okay. I would say nutrition's really the basis and a very large part of it. And many hours are spent with nutrition.
That's great, because in medical school, people don't realize we don't get nutrition.
None.
We don't have
Zero.
any training in nutrition.
Zero.
And believe it or not, in medical school, we were just talking about this. We get about an hour, if that, of menopause.
If that.
I mean, so when you think of someone's been to medical school and they know all about menopause, no, they don't. Physicians in medical school do not get much training in menopause, and unless they do some kind of residency that involves menopause, i.e. gynecology, they don't get much more than that hour.
That's right.
It's all just kind of blended in with, women's care. And so gynecologists get a lot more in terms of education on menopause. And Monica is an OB-GYN just like I am. So you and I, we know a lot about menopause. But the average physician, whether it's your family practitioner, internal medicine,
it's not their specialty.
It's not their specialty. It's not their thing. It's very interesting. So, in case you didn't know that. So, do you consider yourself more of an alternative and complementary medicine physician or more of a traditional medicine practitioner?
Oh, it's such a complicated question. I always tend to start with the least.
Okay.
I would say the most natural options first, depending on the person.
Yeah.
Number one, I work with each person. It's always individualized. I do have some patients who say, Monica, I want this medicine. if it's appropriate, then the medicine's fine. I don't have an issue with medication if it's appropriately used.
Okay.
But always using the smallest doses, when possible, the shortest period of time. But if women are open to natural, and most of them are if they're coming here, most of the time we start with natural.
So most of your patients tend to have a leaning toward the alternative and complementary, would you say?
Almost by definition. And when I say we avoid medicine, it depends. If we're talking about menopause, I would say usually my women start with hormones, most of them.
They just say, give me something that works.
That's it. I'm frustrated. I can't take it anymore. I've had enough. And
I like you as an integrative medicine specialist, but give me what I want.
That's right. I mean, there's certainly a percentage of women who do want natural. Maybe they have a family history of breast cancer and they're trying to minimize. And so I just try to meet each woman where she's at.
Okay. And would you say that integrative medicine is readily available worldwide, or is it becoming more common? Because I wouldn't expect everybody to have heard of integrative medicine.
No, I would say it's rapidly expanding. Rapidly expanding. So I think across the U.S. at this point, definitely in every major city you can find an integrative medicine physician, for sure. I would say that what we're doing here is pretty unusual. Because most of the people who have done the training in integrative medicine haven't stepped away from their mainstream practices. So
it's kind of concealed in terms of it's not standing out on its own.
I think so.
And would you also say that it's unique that you still practice gynecology, you still confine your practice to women, and some integrative medicine specialists do internal medicine, or they can be from any specialty?
Yes. I haven't come across many practices where the gynecologist has truly blended the two.
I see. Yeah, because it's not that common. And do you still practice obstetrics also?
No longer delivering babies. No. 1 year.
That changes your life a lot.
Oh, it does.
When you do obstetrics. It doesn't leave a lot of time for other things.
Well, partly, in large part, I feel like integrative medicine is really about self-care. And I just found that I was having a really difficult time managing my sleep when I was still delivering babies. So I just needed to let it go.
Absolutely. And how much of your practice would you say consists of menopausal women?
50 to 60%, maybe more.
That's interesting.
Large percentage.
That is interesting. And when you get a menopausal patient, how long would you say that first visit is?
1 hour.
Always 1 hour.
Always That's 1 hour.
Face to face with you, 1 hour.
Always.
That's great.
And it's usually a little more than that, but at least an hour.
See, now that's great, because I think a lot of women are frustrated with the fact that so much of the time they feel like they don't get an adequate time frame to spend with the physician discussing.
Well, I think it's very important for them to understand every little detail, and so I try to educate. I try to give them as much information.
But educating an hour is difficult too, isn't it?
It's
very difficult.
It's difficult.
I mean, my viewers know that the videos they're getting so many of them, and they see how much there is to learn.
Just so much, That's right.
Now, are you available 9 to 5 and every day of the week, and it's a full practice? And how does that work as far as your patient's accessibility?
Well, I really see this as a consultative practice.
Okay, that's a great way to put it.
Yeah, so that means basically each patient still needs their internal medicine doctor or their family practice doctor for their general health, but we really focus on wellness and hormones and menopause. So we're open from 9 to 5.
Okay, so it's kind of like you're working in conjunction with the medical community as well as the alternative community and complementary. It's kind of like you have your foot in both camps. I think it's wonderful. I really think it's wonderful, because I think so many patients feel like they fall through the cracks between the two.
Oh, that's it. I use those words every single day, and that's exactly what we're here for. There's so many times I've seen women who, the reality is they don't need very much done. We just need to tweak little things, but it's not being done. It takes
they want
time.
someone who'll work with them and listen to them, and unfortunately that sometimes is not part of the system.
That's right. It's just the system.
In the medical world, And what if you have a patient, so let's say she comes in and you set out a plan, nutrition, exercise, medicine of whatever realm, and you find that she's non-compliant. What do you do in a situation where the patient kind of acts as her own adversary?
Well, one part of the integrative medicine training is really in coaching.
Yeah.
And so I work with people where they're at, and when people are ready, they're ready.
Well, I agree with you. Yeah. Readiness is everything.
That's right.
Readiness is always everything. And you know, I think when it comes to menopause, that I think it's so great that we can do what we're ready to do and willing to do. And as long as you know what all your options are, and you know what you're going to accomplish with different behaviors.
Oh, that's right.
Different choices. I think you can get so much farther than deluding yourself into thinking that you're supposed to do everything, or deluding yourself into believing that you're actually going to do everything, because we all know ourselves really well, and there's some things that we're just not going to do, right?
Well, we get defeated. I think if we feel like there's too many things that are just too much to do, well, I can't do any of those things a lot of times, and so we just give up on all of it.
Give up.
I love the idea of just starting, even if it's walking or exercising, and a person's not done that before. Start with 5 minutes.
Baby steps.
That's right.
Baby steps. Start somewhere, right?
Right?
This is great. I mean, I just find this really fascinating, because I have to say, I don't recall hearing about integrative medicine until recently.
It's been brewing. You know, it's certainly, I think the word started in the late 90s, but I think it's just really taken time.
Yeah.
And I think it's expanding, and I think more people are hearing about it.
Well, and I think there's got to be more of it, because I don't think what's happening now with the two divided camps, I don't think that's working well for people.
No.
I think they're feeling torn, and it's very hard to figure out where to go and what to do.
And Barbie, every time I really love to work with the other physicians, because this is just about us taking care of each patient.
Yeah.
And so I am definitely not in any way opposed to mainstream medicine.
Yeah.
I just like for people to be informed and understand and know what they're doing, and I think knowledge is important.
I think you and I are really on the same page. I think we really have a meeting of the minds as to what's missing out there,
Entirely.
where it needs to go. And, you know, I really think patients should be a partner and be able to really call the shots. But I think they need education in order to do that. And what's lacking is the education. That's the first step of everything, is the education. And without that, you really don't get very far, do you?
That's right.
Yeah. So your patients lean more into the alternative and complementary world in general.
They do. And I would actually say I think a lot of them really are in the middle. And I have people from both sides.
Yeah.
A lot of people come here just because they're looking for bioidentical hormones.
Sure.
A lot of people come here because they're just frustrated that they're just being handed a prescription and don't understand why, not for whatever it is for. And a lot of people just really want to start natural and see if that works first, and maybe don't know where to begin with that.
Sure, they want trial and error. They want to see what works best for them, and they want to have tried more than one thing, and they don't necessarily want to go with the big guns from the start. Right. Yeah. And what would you say is the most common symptom of menopause that women come to you for?
Hot flashes. Maybe, like I told someone this morning, maybe road rage occasionally in Houston.
Road rage. It's hot flashes.
Hot flashes.
Yeah, it's very interesting, because what I've learned doing these videos and interviewing different practitioners is that, by and large, the alternative and complementary physicians and caretakers tend to see a lot of hot flashes, and the medical physicians tend to see a lot of vaginal complaints.
Oh, yeah.
The vagina is, and I guess it makes sense, because I don't think many people think of going for acupuncture and to herbalists for vaginal problems.
I think that's right. I think that's spot on. I think that's it.
And, but it's a myth that hot flashes are definitely the largest symptom of menopause, because I think vagina is
pretty
very close.
Yeah, I think it's right
you're both kind of neck and neck there with what bothers people the most.
I see a lot of insomnia too, and night sweats. I think that's a large part of it. Irritability.
Yeah. And what's the most common way that people want to start their treatment for those common menopausal symptoms when they come see you?
Bioidentical hormones.
Yeah.
Vast majority. 98%.
Seriously, that high.
95%.
Yeah, I think bioidentical hormones are really popular these days. I think people are really feeling like there's something about them that sounds good to them.
Mm-hmm.
I don't know that they really necessarily know that much about them, unless they've been watching my videos.
That's
and
right.
they know a whole lot.
That's right.
But generally, it's kind of the tag word now. I mean, it's like bioidentical. People are throwing that term around, and I think it's great as long as it works.
That's
I think
right.
everything that works is great.
As long as we're mindful with it, I think it needs, I think with any, again, I'll apply what I mentioned with medicine to this too. I think we just have to watch it closely and
Absolutely
monitor.
What if someone comes in and she says, all I want are synthetic pharmaceutical hormones, don't give me any of that bioidentical stuff, forget talking about herbs. What do you do then?
I believe deeply in meeting a person where they're at. I really do.
So you say, okay, that's what you want?
Well, not often. I have 3 patients. I'll just tell you. I mean, they've been on them. They were on them when they came to see me.
Okay.
And they work and they feel very good with them. And I think if you're older and you're feeling well with this, I just hate to change something that's working.
I always say, don't dissect a rose. I mean, if something's working well for you,
that's right.
Don't change it.
That's
just because your girlfriend said, oh, well, I take something. I mean, that's so common for women to change what they're doing because of what someone else is doing or what someone said or what they read. And my attitude is always, don't dissect a rose.
That's
if you're happy and things are good,
I love that. That's exactly.
You're not likely to be happier just because you're experimenting for no reason. Now, if you're not happy, that's a whole different story.
Totally different. Yeah.
So you work really well with all the other physicians, whether they be alternative and complementary or medical, and I think that's so great.
I try to. I think that's my position. My position is really to help women be well.
Yeah.
That's what I see my position as. Yeah.
Okay, so now a normal traditional medicine allopathic gynecologist in the medical center can take care of your surgical problems.
Yes.
And if you have pelvic prolapse or something, they can take you to the operating room and fix that.
Yes.
How does that work for you?
I'm very focused on wellness here in my office, and so this is what I do.
Okay. And so if someone does have something like that, you refer
That's right.
to a gynecologist who can take care of that.
Because there's many people who can do that.
And you're not associated with a medical center. By the way, ladies, this is a house, and it's a beautiful house. It has a fireplace. It's a really pretty setting. It's called the Healing Space, and it's just really pretty.
We love it here.
It's not in a medical center and in a big building. It's very homey and cozy.
But we're very close. That's the beauty of it. That's the beauty of it. You can pull up to the front door.
You're in a neighborhood. You're in a real neighborhood, and so it's a different feel from the very beginning. You just go, oh, I'm in a house.
Well, I believe nature's part of wellness.
Yeah.
I really do, and to me, this just brings it back in and maybe reminds people to spend a little time outside.
Great. So when a person comes here and they want something that your practice doesn't provide, you just refer them and let them know that they come back to you for all the other things.
That's right.
And you'll work together with everybody.
Absolutely.
I love this. This is really a great thing.
Well, I think us all working together is the key. I think right now it's one of the big problems with medicine is we even just with our traditional medicine we have so many divided.
So fragmented.
Yes, it's so fragmented.
Yeah. And I don't think there's anything wrong with it being fragmented from the sense that you get specialists doing what they do best. I think actually that's good because I think having specialists who know one thing very, very well is probably better for you than having someone who thinks they know it all and can do a little bit of everything.
That's right.
I don't have a problem with that. What I have a problem with is that the glue tends to dissipate. There's nobody overseeing the big picture. And what happens in that instance is the patient ends up with the burden of making it all come together and making sense of it all and
That's right.
And connecting the dots.
That's right.
Even when she's told different things by different providers. And I think what's happened most recently is that the fragmentation has gotten to where the communication is worse.
That's it.
All the high technology is supposed to make your communication better, but it really doesn't.
Right.
And because of that, people have trouble passing on the message between themselves. And I think the patient is left feeling like she doesn't know what's going on. And I have a problem with that. And one of the reasons I do these videos is to try to make sense of things for women and teach them from the beginning what's out there, what to look for, what the differences are. The reason I'm bringing all of these professionals to the women is because I think the best way for them to know how they differ is for you to tell them.
That's right.
You know, and it's really wonderful that there are so many different options out there.
Right,
you know,
right.
different professionals, and I think
That's
we all want
right.
the same thing. We all want the women to be happy.
That's right. I always say I definitely don't think that there's ever any ill intentions with any of the physicians.
Right, never.
It's
never.
just a miscommunication.
Yeah,
that's all.
Absolutely.
A lot of times, actually, I'll help kind of connect the dots for
Yeah.
people, and that's
Yeah.
a lot of what we do here too.
I think it's great. I think it's great. You and I are both glue.
Yes, glue. Absolutely, absolutely. It's amazing. That's right, glue.
It's a good role. I
Yeah,
like it.
love it.
Thank you so much, Monica.
it's
This
such
has
a
just been
pleasure.
great. You're wonderful. And
Pleasure.
ladies, your contact information for Dr. Roberson is in the descriptive portion of the video as well as on my website. And I hope you can find integrative medicine physicians where you live. And you know, I think that there is a way to do everything no matter what you want. So I'm glad you now know what an integrative medicine physician is. So we'll say goodbye to you now, and we'll see you again in a week. Don't forget to follow me on social media, Facebook, Instagram, and Twitter. I'm there. Follow me and come see me again in a week.
Thank you.
Bye.
Bye.